there's some obvious places that voice can make an enormous difference in healthcare. You look at this concept of micromedicine. So at this point, we're printing medicine based on information about that person. The concept of doing a genome sequence is now gone down to $100. So your next doctor's visit, it's starting to make sense that everyone that do a genome sequence, so that when they prescribe something, they prescribe what exactly should work for you. So what that means is that almost all medications is in some sort of clinical trial with the patient that's taken that medication. So Orbita has put a lot of effort into what does it mean to do clinical trials. And these are everything from daily diaries to assessment surveys, the ability to have a knowledge management around the drug that they're taking, side effects that they're doing, and literally a 30-day plan to get someone to, because when a person starts taking the medication, their body will react. If they can only get past that first 72 hours, and this is how a voice assistant can help them along their journey to be successful in doing it. So that's one area. Another area is things like working with healthcare systems on patient discharging. I need to educate the patient when that person walks into the discharge room of what do they do. If you're over 65 years old, you have a 1 in 5 chance of coming back into that hospital. And half of those people come back just because they didn't really understand what they were supposed to do. And so they show up in the emergency room because they think they're having some sort of reaction, which is probably normal. If they just knew what happens. And so better using voice assistance, but not only voice, a visual display like an Echo Show to actually show them when they say, here's how we're going to treat the wound when you have a hip replacement, and this is the colors that your skin is going to turn yellow after a certain period of time. And if the user understands that, they might not think, oh, this yellow means I better go to the hospital because I have gangrene or something like that. And so working with healthcare systems to do things like better patient discharge. Another area that we have a lot of focus on is just remote patient monitoring. So a patient goes home and the ability for them to interact through a voice assistant, to give them notifications to remind them of medication management, to be able to do things like when the person's temperature is going up, to provide an assessment survey, to ultimately know if this is creating an alert state so that people should get notified. And ultimately educating and using these devices to educate their family members, who can be a very important part of the care of that patient. But today, if they don't know or are not educated, then they can't really be that connected to how to interact with that patient.